When things like this happen,
Yeah.
what can you see happening with kids?
Well, that's a very good question. I think depending on their age, it can make them feel overwhelmed, feel anxious, feel a bit scared and uncertain about their safety. For example, kids that are at preschool level, a young age, you might see difficulties with sleep. You might see them not want to leave their parents' sight when they go to school, like they don't want to be
Right.
separated from them. You notice, when it comes to playtime, they don't want to go outside and venture out. They might be feeling a little bit uncertain about the situation and their safety's at risk.
What can parents do then if that's all happening because of terrible situations like
Right.
this and kids are feeling anxiety?
Right.
What should parents do and how can they talk to their kids about that?
Yeah, I think the first thing is showing them that you love them and you give those affirmations of love and support and care, and that they know that you're there for them, whether it's a hug, whether it's affirmations. The other piece is, teaching them through your own behavior. So you yourself remain calm. You don't demonstrate overreactions or anxiety yourself.
Right.
You also keep them in their normal routine. Life has to go on, and you don't make them feel that the world has changed, and to ensure them that there's still safety in the world, there's still good people in the world. And also, it's important to talk to them. Depending on their age, it's important for the parents to interpret the facts and provide the facts of the situation, and in an age-specific way, talk to them.
What about if they're having specific anxiety about details of this, like now walking on sidewalks, that kind of thing?
Right. So I think that's a key thing to look at is behavioral changes. So if you're noticing, you might even notice physical changes like stomach aches or headaches. Behavioral changes would be things like you mentioned not wanting to go outside, maybe not doing well in school, maybe avoiding situations or social settings. It's important to talk to them, to be aware of it, to be mindful, to ask them what's going on, and to have them express to you what they're feeling, to give them that validation. And for some kids who don't have the capacity or the ability to express their emotions, you could ask them to write things down on paper, maybe journal something. And if you're noticing it's becoming progressive and it's not tapering off with time, that's a time to not have any shame about reaching out to a mental health professional and seeking out some supportive counseling to help them with their anxiety.
And we have social media coming from everywhere, news coming from everywhere. Can that actually add to people's anxiety? Should they be thinking of disengaging? How do you manage how much you immerse yourself in
Right.
this?
I mean, that's the question of the day with social media, because there's so much access to information. And if you're immersing yourself in repeatedly in media images and getting stuck there, that could be reinforcing your anxiety and it can make you replay it. So I think disengaging in those situations is important, to say that I can't continue to kind of torment myself by keep looking at this, and disengaging, and maybe in response to that is calling up a friend or going for a walk or getting support from a loved one. But absolutely, if you keep replaying it, it can heighten your anxiety, and it can lead to kind of similar symptomology that you'd find in responses to traumatic stress, where people have intrusive thoughts and flashbacks and reminders. And this process of continuing checking your Facebook or your feeds is playing into that, and it can make things worse for you.
Can that cause you to even have the same amount of anxiety or post-traumatic stress as somebody who is actually there because you've immersed yourself so much?
Yeah, I mean, they say that exposure to repeated images or events that are traumatic in nature can cause traumatic symptoms in the person who watches them. Absolutely. You can have similar symptoms of anxiety, distress, arousal, avoidance behaviors because of something you've watched, because of something you've seen on TV. And it can create those similar symptoms you'd find in a clinical diagnosis of PTSD in someone else. Absolutely.
So how do we monitor that? How do we
Yeah.
keep ourselves,
Yeah.
informed but disengaged as well?
Right. I think it's the idea of, how it's about balance, right? It's about, like you said, you want to be a healthy consumer of what's going on in your community, in your world. But it's that balance point. If you notice you can't stop playing it and you're getting anxious, or you notice that even if you've stopped, you're still feeling that you're having hypervigilance symptoms, you're looking around, you're more active, you're having negative thoughts of bad things happening, you feel like you're avoiding certain places and not feeling safe, and you're feeling concerns about your own well-being, and it's not just fleeting, it's kind of consistent and persistent, that's a sign that maybe you need to disengage, reach out to a loved one, and more specifically, reaching out to a mental health professional.